Welcome once again to another episode of Ask the Doctor. I'm Dr. Wale Okediran, a general medical practitioner, a family physician of 45 years standing. As usual, I will be answering questions sent to me by my patients. We have 8 questions to answer now. The first question has to do with the fluoride and cancer. And the question goes like this. I read somewhere that fluoride can cause cancer. I will appreciate it if you can clarify this for me. And my answer is this. The story about fluoride causing cancer is not true. Overwhelming research shows that there is no reason to believe that fluoride, which we can find in our toothpaste and in our drinking water, when used in an approved manner, it does not cause any disease, including cancer. And it is also a naturally occurring mineral that can be found in the soil, water, plants, and some food items. Therefore, there is no fear, there is nothing to fear about fluoride causing cancer. Then the next question has to do with if another is from a lady. It says, I recently discovered that each time I urinate, I usually see some bubbles in my urine. Can you let me know what this means? And my answer is that when you pass urine and you find bubbles, it can be normal because sometimes, depending on the speed by which you urinate, if you urinate very fast, you can find some bubbles coming up in your urine. But however, if you do this and you notice that each time you urinate, these bubbles occur every time, then you may be worried because it's not supposed to be occurring every time. And this can be caused maybe because of protein, that is excessive amount of protein in your urine. This will need further evaluation. And because of this, you will need to see a doctor who will take a sample of your urine and send it to the laboratory for checkup. The next question is asking whether this is a worm infection. He said, I have a mild chest pain, which I believe must have been a result of drinking muddy water from the well in my house. I'm suspecting worm infection. Can you let me know what to do to clear it? And my answer is that if you suspect that you have worm infection, you are allowed to buy some worming tablets, which are available from any pharmacy. You can go to a pharmacy and tell them there that you suspect that you have worms, and they will give you worm infection and worm medication, which is something that you can buy across the counter. And it is also good if the whole household is treated, because if all of you are drinking from the same well water, which you said is muddy, then all of you should treat yourself. However, if after treating yourself with this worm medicine, the symptoms and the signs which you have complained about do not stop, then you need to see a doctor who will do further treatment, including maybe taking sample of your stool for tests and also do some blood tests. Then the fourth question is this. He says, my dear doctor, my 15-year-old daughter is yet to commence menstruation. What can cause the delay? Should I be worried? And my answer is this. Menstrual period will start when the body is ready. And this is usually between the age of 8 to 17, or 2 years after the first signs of puberty. That is when your daughter started having breasts and maybe hair in the armpit. However, you can have some delay if the person concerned is underweight, that is, he has lost a lot of weight, or is doing a lot of exercises, including dancing, gymnastics, and athletics. If there is stress and if there is a hormonal imbalance. So the first step to do if in treating delay in having menses is to determine what is causing it, so that a complete and accurate diagnosis can be done. If your daughter hasn't had her first menstrual cycle by age of 15, or more than 3 years have passed since she started developing breasts and having hairs under her armpits, you may wait for more than 1 year before you see a doctor for full checkup. Because like I said, the age can vary between 8 and 17 years. So sometimes it's not good to be worried unnecessarily. But if after 15 years of age, you can wait for another 1 year, then let us do a proper checkup. Then the next question, it says, I've been having tingling sensations in my hands for some time now. Kindly let me know what this means and what can I do about it. I'm a 40-year-old civil servant. And my answer is this. Tingling sensations in the hands and feet are sometimes very common and can become very disturbing. And then, in addition to these tingling sensations, if you feel you have some pricks and numbness or burning sensation under the skin, then this can be worrying. For example, it might happen when there is weight or pressure or arm under your head as you sleep, or it could result from pressure on your nerves when you cross your legs for too long. In either case, the pins and needles effect are usually painless and can be relieved when you remove the pressure causing it. However, when the tingling sensation in your hands and feet are severe and long-standing, and then maybe it also comes with some other symptoms like pain, itching, numbness, and muscle wasting, then in this case, the tingling sensation may be a cause of nerve damage, and you need to also check it. It can be caused by nerve damage, it can be a trauma or maybe injury to the nerve, or it could be bacterial or viral infection, or during when patient has diabetes. Treatment of tingling sensation in the hands and feet depend on the underlying cause. If it's not due to the nerves, then it's important for you to do a blood sugar checkup so that you can rule out diabetes, because sometimes this diabetic neuropathy can cause tingling sensation in the hand. And then sometimes when some vitamins in your body are deficient, you can have these nerve sensations, and that is why some major vitamins supplements can also help. Then sometimes you can need physiotherapy if there's a pressure on the nerve in part of your body that is causing this sensation. But for you to know what is causing this thing, you will need to observe the way the nerve problem is, and then you also need to see a doctor who will do a thorough examination to confirm the cause of this tingling sensation. The sixth question is from one gentleman who says that, I noticed that my 70-year-old father has recently been walking with a shuffling gait. He's not walking smartly again. He's having a shuffling gait. Can you let me know what could be the matter with him? And then I answered him that aging process can naturally lead to some muscle loss, especially in the thighs and the legs. This condition is known as sarcopenia. It usually means that the muscle is becoming flaccid, and it makes it harder for these seniors to lift their feet properly or to walk properly, and that is why they usually have a shuffling gait. The solution to this is to engage in some strength training exercises, such as the one you can have in the gym. You can have some minor workouts. They can add them to be pushing some weights, and that this way to keep the muscle fit. And it can also, and then sometimes it can be the shuffle can also be due to some underlying illnesses like Parkinson's disease or other infections. And the important thing is to find out from a doctor whether there's any underlying illness. And to know this, the doctor will order some tests. They have to do some blood tests, check your blood sugar, look at your blood pressure or your father's blood pressure to make sure that he doesn't have high blood pressure. And once these tests are done and there is no underlying cause, then that means the person will need just to go to the gym and do some physical training. Then the next question is, he wants to know whether there's any permanent cure for piles, that is hemorrhoids. And I said, as of today, there's no permanent cure for pile. And just to let you know that pile can develop from increased pressure when you want, like straining, when you want to push your bowel, or sitting for too long period on the toilet seat, or when you have chronic diarrhea or constipation. Unfortunately, there is nothing as a cure for getting rid of pile, but there are ways of reducing the infection of these piles, and that is why you need to make sure that you are not constipated, so that you don't have to be pushing all the time, and then you treat your diarrhea quickly. And for those who already have pile, you make sure that you eat plenty of fruits, vegetables that will soften your stool, and drink plenty of water, so that your pile will not be disturbing you. The final question is about kidney. The man wants to know, he said, can you let me know what to do so that I can have healthy kidneys? And my answer is that if you want to have healthy kidneys, it is advisable to drink enough water, about 6 to 8 glasses a day. That is about 6 or 8 pure water sachets of water every day, so that your kidney can flush out your waste easily. You should also reduce the salt you take, because too much salt can affect your kidney. And then reduce the kind of junk food you eat, like snacks and sugary drinks. And then don't eat too much of fried foods or anything that is bought in packages. Exercises are also very good. Regular exercises will help you to keep your body in good shape. Reduce your alcohol intake, and if possible, don't smoke, because smoking can also affect your kidney. This will damage your kidney over time. And then I also said that anytime you are feeling tired, or you feel your body is giving you signs, like you are going to the toilet, you urinate too often, it's important that you go for a medical checkup, so that all these things can be taken care of. And lastly, avoid too much intake of painkillers. All these heavy painkillers like ibuprofen and co. If you are too much, it can affect your kidney. So this is where we're going to stop today. Once again, I'm Dr. Wale Okediran, a general practitioner of 45 years in practice. Next time, we shall go through another set of questions. Thank you for listening.